All right, our first question is, what is the biggest challenge for feeding COVID patients?
I can chime in on this one. This is Yolanda, and I'm a clinical pharmacist at Wellstar Cobb Hospital. And I will say that since we have adopted the Decadron protocol from the recovery trial, we definitely have issues with maintaining tight blood glucose control for those patients, and it does become a challenge. It's just one extra thing. We want to keep the patients as euglycemic as possible because we want to prevent any additional infectious process or superimposed infection on top of COVID-19. So that is one thing that I see so far.
Hi, this is Khatija Jivani. One of the challenges that we've seen is that patients are just not being fed with PN, mostly because there's a concern for volume overload. So these patients are going for a prolonged duration without any kind of enteral nutrition because of their high oxygen needs. And then doctors are a little hesitant to feed them through PN because of fluid needs. So we're trying to feed them and we're trying to be aggressive with parenteral nutrition, but these patients also don't often have central lines. So we're having to underfeed them with parenteral nutrition and give them a very low volume. So that's definitely a challenge that we're seeing at our facility.
And this is Marlene Neville at Northside Hospital, Atlanta. I would second that, what Khatija says in terms of trying to adequately feed these critical care COVID patients. We're having a lot of problems with enteral intolerance, and a lot of the critical care staff is reluctant to try even low volume TPN on these patients because of, I guess, fluid concerns. So I think that's a significant issue.
Dr. Rosenthal, would you like to add in on anything specific from your facility as far as challenges go?
Yeah. I don't see Dr. Rosenthal still logged into the presentation, so we can go. We have another question, and please, anyone else, please submit your questions via the chat. But we do have a second question that has come in. What kind of supplements do you give to COVID patients?
So this is Vivian. I'm a clinical nutrition support pharmacist, and I'm from Emory Hospital. At Emory, we actually had a standard COVID power plant for all the COVID patients up on admission. So typically we actually at admission, we have a standard set of lab that will check for all the patients such as thiamine, vitamin C, D6, vitamin D, A, copper, zinc, selenium, and total and free carnitine. And as soon as lab is being drawn, we will start kind of like an in-pair supplementation of B1 200 milligram either as IV push, or if the patient has a feeding tube, we're able to take oral, then we do a 200 milligram. We also do vitamin B6 100 milligram, and then vitamin C 1,000 milligram, and then vitamin D 10,000 unit oral or via feeding tube every day. And then we also technically do zinc 220 milligram a day as well. And as I mentioned, we're checking levels, and so far we haven't been able to really look at, have time to actually look at the data and see what we're supplementing is sufficient yet.
Thank you. Would any of the other panelists like to add to
this
that?
This is Yolanda again, and I would like to add that based upon computational structure analysis, famotidine early on had been identified as a potential, 3 chymotrypsin-like protease and papain-like protease inhibitor of SARS-CoV-2. And it's not that I am arbitrarily adding famotidine to parenteral nutrition, bags. However, if the patient does carry an indication for antacid, then I ensure that famotidine is placed into the bag. Currently, there are 6 trials cataloged on clinicaltrials.gov that are evaluating the efficacy of famotidine in COVID-19 patients. And, you know, there aren't any firm studies, of course, to show that it is definitely of benefit to patients, but preliminary results have shown that patients on famotidine versus pantoprazole fare better. So I will add that to my parenteral nutrition bags.
Thank you. If anyone else would like to submit a question, please do so at this time.
Laura, it looks like Dr. Rosenthal is back on, so can you re-ask that first question and we can ask him to chime in?
All right, Dr. Rosenthal. So we had 2 questions actually come through. So what is the biggest challenge for feeding COVID patients? And then also, what kinds of supplements do you give to COVID patients? So any responses to either of those questions?
Yeah, sure. So to be fair, when we have a pure COVID patient that comes into our hospital, they go to the MICU, the medical side. But if it's a trauma patient as complex as that one, and they are COVID positive, I keep them in my hospital, in my ICU. But the problems that some of my colleagues have actually seen is, you know, it's everybody was a little bit fearful of the virus at first. It's very hard to, you know, fully engage into patient care for our nurses when they know the patient has COVID-19. They have to don on all these PPDs. If they forget something in the room, it stays there. There's all these issues that come up with taking care of the patient. It's the problems for nutrition strategy or feeding these patients is probably the same as, you know, anything else that we had to do for them as far as giving medications, rolling them. You know, anecdotally, we've seen that the number of pressure ulcers have gone up in this patient population because they're not getting turned every 2 hours. And so it's a scary disease, especially for those, you know, that may not be well themselves. They don't want to get that exposure. But the supplements that I would give these patients would be the ones that are borne out in the literature. I know that there's some recommendations for vitamin D and sorry, my dog is going crazy in the background. But the vitamin D, I think vitamin E, certainly omega-3 fatty acids. If you could get your hands on resolvins, because there are certain species of SPMs out there. I think they're more in the European countries, but those would all be some of my recommendations, as well as probiotics.
Great, thank you, Dr. Rosenthal. At this time, I have seen no further questions coming through.
I do have one question. Do you see gut dysfunction in COVID patients?
Like global GI issues, like feeding intolerance, or what type of gut dysfunction are you talking about? Just in general?
Yeah, just in general. Enteral intolerance, or yeah, anything like that.
No more, no less than anybody else. The problem comes though when the sicker they get, the more GI intolerance they will have. But that's also the nature of the disease. Like if you have somebody who's so sick that they might be going on ECMO, you can imagine that the rest of their organs aren't going to be working all that great.
Mm-hmm. Thank you.
Mm-hmm.
This is Yolanda. I just wanted to throw out there that also, speaking of logistics, I ensure that, you know, labs are condensed to one ordering time just to prevent phlebotomy burden and prevent potential exposures. Sometimes we find that certain labs have been left off, and as opposed to ordering or placing a brand new order for a lab, you know that I can just do an add-on to the earlier blood sample to make sure, say if like there was a missing mag or phosphorus level, that I could just add on to the sample that was already collected and resulted earlier in the day. And, as a pharmacist, I also look for ways to, just condense administration times to also prevent that burden on nursing and limit exposures as well.
100%. And to piggyback that, I don't know if other hospital systems saw this, but we actually ran out of kangaroo pumps. And so we had to do gravity feeding, and that can be labor intensive. And our patient populations, the surgical patient population was not the COVID unit, but I can imagine that if we're having to, gravity feed COVID positive patients, that can certainly get a little bit overwhelming, I would think.
Definitely.
All right, we've just had another question come through. And the question is, we are hearing a lot that there is a concern to start PN in patients who aren't tolerating EN, enteral nutrition, tube feeding, at goal because of the concern about infectious complications with PN. Can you comment on that?
No.
You want me to answer that, or I don't want to monopolize everything.
No, you can go ahead. We don't really have that concern we haven't had that concern at our facility. I'm at Northside Hospital, Gwinnett. We haven't had that issue come up in the patients that we have fed with PN, and Marlene from Northside Hospital, Atlanta has said the same thing, and same with Emory.
Yep, same here at COP.
So Dr. Rosenthal,
have you encountered that at all?
No, we have not.
So the consensus seems like that there isn't a concern for infection. I believe there are probably some hospitals out there that are not as aggressive with feeding, whether it's EN or PN, because of some of these concerns. So it's good to know that at least in this area and amongst this group of panelists at the different hospitals, that's not a concern.
All right, thank you, everyone. That was our last question.
Excellent. Thanks, guys.
Thank you, Dr. Rosenthal.